And despite the vaccine rollout progressing, many questions remain. Is a one-shot approach better than two? When can we stop masking? Our Zach Fuller spoke with Dr. Virk of Mayo Clinic to get some answers.
This discussion about, spreading the doses out to more people is obviously a valid one.
Mayo Clinic's Dr. Virk says that question comes up every pandemic or epidemic.
And we know that the one dose is anywhere between, 50 to 80% effective. So, are we really going to impact the pandemic if we do that?
Dr. Virk says that answer is still not clear, but they have found new data for people who have already had COVID-19.
People who have had prior COVID, if they get one dose, they seem to have a really robust immune response.
Which is the whole point of vaccines.
First and foremost is to prevent people from dying, right? First and foremost is prevent people from getting into the hospital and having all sorts of complications.
And while COVID-19 trends in the U.S. are going in the right direction,
COVID-19 in the United States has been declining for 5 weeks, with the 7-day average dropping 74% since the peak 7-day average on January 11th.
But it's too early to tell if that is because of vaccinations or something else.
So is that because of other efforts or is it because of vaccination? I think it's a little too early for us to say that that's a vaccination effect, but it certainly could be.
Which has some suggesting we may be masking even into next year.
Do you think Americans will still be wearing masks, for example, in 2022?
I think it is possible that that's the case.
Virk agrees that could be the case. So, how will we know when we achieve herd immunity in terms of having enough people vaccinated?
The estimate of what is needed to curtail the transmission is somewhere between 60 to 80%.
Zach Fuller, KTTC News.
Dr. Virk says Mayo is working on its own studies, including one looking at virus transmission after receiving the vaccine. Adding the problem with trying to study it is that with masking and social distancing, it's hard to tell what the true transmission rate is. She also says she welcomes Johnson & Johnson's vaccine to come into the fold if approved by the FDA this week.